Hello, everyone. My name is Don Self. Today, we're going to talk just a few minutes about one of the biggest reasons, or one of the primary reasons why I see claims denied. It's because we're not actually connecting the diagnosis to the procedure. So we're only going to take a few minutes to do this, but let's go over these things. Why are carriers denying the claims? They always give you a code why, and oftentimes the remark code may say it's because the diagnosis does not match. And sometimes people will sit there and say, but wait a minute, I had the diagnosis on the claim. Yeah, but it goes beyond that. We have to make sure we're telling the carrier why we're doing every line item. As an example, let's say we filed this claim right here by Dr. Feelgood on today's date. And we have an office visit, we have an EKG, and we have removal of impacted cerumen via irrigation of the right ear. That's what these diagnoses, these codes right here are telling us. We look up here at the very first diagnosis and we find pharyngitis. Second one, hypertension. Third one, impacted cerumen, right ear. And you say there's a specified ear foot? Yeah, that's what that diagnosis. If it was a 861-22, it would be left ear. Oh, okay. Then you look over here, the big part right here that's so important is diagnosis pointer. Diagnosis pointer is going to tell the carrier, why did I do an office visit? I did it for pharyngitis. That's the first code. And that's the first one that they're going to look at right there. They're not going to look at all of them. The second one's going to be, we did an EKG. Why? Pharyngitis. We removed impacted cerumen from the right ear. Why? Pharyngitis. This right here would be telling the carrier things that would cause the claim to be denied. So let's take that same situation, but let's put the claim the way it should be. You'll notice here an A, a B, and a C. We did the office visit for the pharyngitis. We did the hypertension for the, we did the EKG for the hypertension, and we did the removal of impacted cerumen for the impacted wax. And that is telling the carrier exactly why we did it. You sit and say, well, I don't actually look at the claims. Well, maybe you're using something like eClinical. Then just make sure over in eClinical where it says ICD-10, the first one, that you link to the right one. Like in this particular case right here, this was one of my clients, and I logged into their EC system, ECW, just to be able to make this webinar. And I have login access to my retainer client so that I can go in there and help them stay out of trouble. And no, I'm not a billing agency, I'm a consultant. But you notice, come back here. Okay, we had an office visit level 5, which I might want to go back and take a look at that medical records on that one. Office visit for the first diagnosis, type 2 diabetes with hyperglycemia. We had the blood sugar test, 82947, again for the same diagnosis, and the EKG for the bradycardia. Patient's heart rate was too fast. That's the way it should look. Cool. We look at Cario, Atibra right here. I think they just changed names. This particular patient came in. This was a child, by the way, acute pharyngitis, fever, and this particular pediatric patient had some BMI issues. All the lab tests and the office visit was all related to the first diagnosis, which is pharyngitis. That's the way it should look. So make sure your system is not throwing an A into everything and you are correctly linking the right diagnosis. If we can ever help, we'll be glad to consult with your practice. Keep in mind, unless we help you increase your income by at least $50,000 a year, we typically don't charge for our consulting because most practices are making the same mistakes. If you ever need to, reach out to us, donself.com. Thank you for allowing us to be of service to you today, and keep watching for the videos.